Dr. Anthony Fauci joins us. He's in Washington right now, and he is the director of the National Institute of Allergy and Infectious Diseases and a member of the White House Coronavirus Task Force. Good morning to you, Dr. Fauci. Good to see you. It seems like a good day. We're hearing news of a second vaccine possibly being authorized by the end of the week, 95% effective, which is really exciting. So what do you think it's going to take now to have a real impact to slow the spread of this virus, with two possibilities now on the market?
Well, what we're going to see, Gail, is an increase in the number of people who ultimately get vaccinated. When you reach a certain percentage of the population to get vaccinated, you're going to really have an important and profound impact on the dynamics of the outbreak. So it's going to take a few months to do that. You know, the first level of people are the healthcare providers and those who are, for example, in nursing homes and long-term facilities. And then after that, you're going to start seeing other priorities coming. I would imagine by the time we get to, let's say, March, end of March, beginning of April, we will have people who are in the general population that are not in any particular priority groups. And we hope that the overwhelming percentage of the population will accept the vaccine. If we do that, we will get a veil or an umbrella of herd immunity over the population that would dramatically diminish the dynamics of the outbreak. When we do that, then that will be the end of this outbreak. So it's going to take months to do, but we certainly are on the right track.
We hope so, too. We keep hearing you need at least 70% of herd immunity for it to be really effective. What's the biggest challenge, do you think, in all of us getting there?
Well, the challenge is the acceptance on the part of various elements in our society. You know, particularly, and we're working very hard, minority populations understandably have somewhat of a skepticism. I've been out there, my colleagues have been out there, trying to outreach to this group of individuals and explain to them the things that make them skeptical, or, for example, the speed with which this has happened. That's a really good thing, Gail, because the speed is a reflection of the extraordinary scientific advances in vaccine platform technology that allowed us to get here quickly, and also the enormous investment that has been made in developing and producing doses of vaccine so that they're ready when the FDA makes that decision. That's exactly what happened with Pfizer, and that is what is going to happen with Moderna.
And I'm wondering how you're feeling during this time, Dr. Fauci, as you see the vaccine rollout, because we had a moment at the table the other day. We actually thought, we got emotional looking at the trucks rolling out, and you've been working on this most of the year. So I wonder what this is like for you to be here at this place at this time.
Well, it's an extraordinary feeling, Gail. It's a very positive feeling. You know, as I've also even mentioned to my own family, my wife, is that as wonderful as this is, because it's been, you know, an extraordinary manifestation of the fruits of science done in a very rapid way, it's also bittersweet because, you know, the other day at the time that the vaccine was first rolled out and put into someone's arm, we reached the 300,000th death in the United States from this virus. So, you know, we should celebrate the fact that the science has come through, but it is not over yet. We have a ways to go. We have to abide by the public health measures that we talk about all the time. This is not going to just turn around overnight. We have a ways to go, and public health measures is the bridge to get to the vaccine, which is going to get us out of this.
All right, Dr. Fauci, thank you very much. And before we go, are you on a couchie?
Not really, Gail.
That's what I'm getting you for Christmas, a Fauci on a couchie. All right. Thank you, sir.
All right, thanks, Gail. Great to be with you.
Oh, Gail,
you know
I
he
love
wants
that.
one of those.
I know he wants one of those. I love that we can laugh a little bit and smile in a new way.
I feel that too,
Such
Tony.
a hopeful moment.
Yeah. I feel that too.
Was full of hopeful details. The vaccine is coming. And one of the first people who got the shot there at UC Davis happens to be my brother-in-law, Jamie Turr.
Why did he get it?
He is an ICU COVID doctor there at UC Davis, and I had not put two and two together that was the hospital where David was reporting and my brother-in-law's. But we got the video last night.
That's really cool.
He's the first member of the extended Turcopel family to get it. He's feeling great.
Yeah. No side effects?
No side effects, and he's raring to go.
I love David's piece, though, how he took us from point A to point B all the way to Z Do you see them actually getting the shot? And I don't think we can emphasize enough how important this is
Yes.
and how hopeful that it is.
And it's
It
great to
really
see how
is.
excited everybody in the hospital was.
Yes.
Yep.
It's
Yes,
protection and
yes.
it's relief. We're feeling it.
Big time.